Hello and welcome to yet another interesting edition of Health Matters, a program where we'll be discussing your health needs, and it's reaching you live on NTA Channel 12 Uyo, your dependable station. I'm your host, Umar Basidit, and with me today we have the President of the Medical Women's Association of Nigeria, M1 Akwa Ibom State Branch. That's talking about Dr. Uduak Usama. Hello and welcome to the program.
Thank you very much. Good afternoon.
Yes, today we have on our front burner a very interesting topic, and it's malaria. You'll be asking, what about malaria? Malaria, you just walk into the chemist and you get, if I are the one telling the chemist man that you want to drugs.
They even tell the doctor that I came for treatment of malaria.
I came to treat malaria. I want to
malaria.
lots of malaria.
That's
because people don't see malaria as one very common disease, but I'm going to shock you. You get to realize that malaria is a killer disease, and so it shouldn't be joked with. And that's why we have brought a health professional to tell you the truth about that malaria that you've been joking with. So, Ma, tell us a little bit about malaria. How serious can malaria be?
Thank you very much. Malaria, in our language, in Ibibio Akwa Ibom, we call it Utonyen. And it is a killer disease. It is a killer disease in that if you don't take care of your environment, your health, where you live, preventable measures. In fact, malaria is preventable. Why is it preventable? Because our environment and where we stay can affect our frequency of having malaria. So we call it a killer disease because, especially in children, if malaria is not taken with very serious care, you might lose your child. You as an adult might die. So malaria should not be looked upon as something that is waved aside. Malaria is a condition that you have mosquito bites. There is no other thing that gives malaria apart from mosquito bites from the female genus of Plasmodium Anopheles. Is the female that bites. Everyone will ask, why are the male not biting? Research has not told us that the male are biting, but the female are biting. So that's why I said it is a preventable condition. By taking care of environment, we keep our environment clean, we remove stagnant water, we use insecticide-treated mosquito net, ITN nets. There is what we call indoor residual spray, IRS. We spray our rooms. There is what we call a modifiable dressing. What I mean by that is in the evening, because research has shown that the malaria mosquitoes bite more in the evenings. So if you're going out, you wear things that will cover your legs, your hands. In fact, you could even cover your head, so that, and especially for children, it is something that if you prevent these mosquito bites, malaria will not affect you. That is why I said, please, malaria is preventable, is treatable, and it is actually a killer disease.
Okay, now talking about malaria, thank you, Dr. Sama. We have issues of people having to treat malaria like every other week. Is it that they are not treating it well? Is it because some say it's resistant malaria or something? So what exactly is the problem? Or is it peculiar to our people? Is it because of our environment? Why are we going down with malaria always, like frequently?
Thank you. The environment we are, Nigeria, is is what we call malaria belt of the world. It goes like that. When you see malaria in the map of the world, there is what we call malaria belt. So malaria, it is normal for us to have malaria infection. So once we know that we have this challenge of malaria, that is why we are talking more of prevention. And why is it that when we take anti-malarials, it seems as if it's not working? It is not all fevers that are malaria. But we misinterpret fevers, symptoms of headache, fever, even loss of appetite. Sometimes you could have body pains, or you just feel chills, what we call fever and chills. Inside your body, you're feeling cold, very cold, but if somebody touches feels your temperature, the temperature might be normal, but you are feeling cold inside. Some people would say they would like to walk under the sun, or they stay where there is a little heat, not all fevers are malaria. So what is being practiced now in the hospital is what we call RDT, rapid diagnostic tests. So that when you go to the hospital, the first thing they will check is to prick your finger, and we check. There is an instrument they use in checking. It will show if there is malaria. If there is no malaria in that result, we will not rush to treat you malaria. We are not saying that malaria will not be there, but there could be other causes. We could have other those symptoms could portray. Maybe somebody has UTI, urinary tract infection. It could just be stress. It could not be that dehydration. The person is not drinking enough. He's not drinking enough water. Thank you very much. Person is not resting enough. The person might have even stayed throughout the night. You know, these days of this our technology, we spend more time on our phones, on our laptops. You finish with phone, you have a mail to reply, then you are checking other maybe WhatsApp messages, Twitter, Instagram. There is so much that is taking our time, such that we are not even resting enough, so that we start developing headache. Somebody will just run to the pharmacy and say, I came to treat malaria. In fact, a patient will walk up to the doctor and say, I have malaria. So when we do this test, rapid diagnostic test, the main thing is what we call in the microscope. They will check the microscope and say germs are staining. But why we do this rapid diagnostic? Because we are a resource poor, low income country. So those ones don't need electricity. For those tests to be checked under a microscope. The microscope has to work, the electricity must be on. So research made it possible for us to check for malaria. So I'll encourage us, please, that whenever we have these symptoms of headache, fever, loss of appetite, vomiting, sometimes maybe you're even urinating a lot, as we had thoughts about in other conditions that could cause excessive urination, we now think it's malaria, even diarrhea. So it is best to do that test to prevent taking too much anti-malarials, so that when you are actually having the malaria, the drug will work with speed.
Okay.
Yes.
So are there consequences of treatment without running a test?
Yes.
Because I know that sometimes, like we said earlier, people just go and start treating themselves. So what happens? What are those effects of doing those kind of habits?
Okay, thank you. By the time you just take so much anti-malarials into your system, there will be a time your body cells will think recognize it as normal, such that the efficacy of that drug will not be as much as somebody who was not taking it. Your body now identifies it, oh, it's normal for me, it's normal for me. So it will cause resistance. At a certain stage, those drugs might not work in the body anymore. You now say, okay, I don't like the one that is Coartem, that's 4. Let me go and take the one that is a capsule, that is 1 morning, 1 evening. You will take that one so much that your body will now resist that. You go and take the one that, okay, is suppository. You now put in the anus. So it is best to be seen by a medical professional. They will prescribe tests. After the test, they will now say, okay, this one is malaria. Sometimes we even have 2 or 3 pluses. We know, should you go on to the injectable first, then you follow up with the tablets, because sometimes the malaria you're even thinking might be much in your system that you might have to start with injection. Injection could be 2 types, could be IV, intravenous, it could be IM, intramuscular. So you might not really know those things, which one to start with, but by the time you visit a medical personnel and the lab test is done and you actually have malaria, we will be able to know which one to give you and which one not to take. Then we will also conduct other tests like urinalysis, blood counts, because this malaria could actually bring down the hemoglobin of the patient, what we call packed cell volume. Yes, by doing other tests. We won't just do an RDT for malaria parasite. We will do other tests. We could tell you to submit urine. The blood, we could do a full blood count. That full blood count will indicate the other levels of parameters that are composition of the blood. If it's reduced or too high, that could point to other directions that this person is not, even if it's malaria negative, RDT negative, other causes that are producing these symptoms the person is coming down with could be treatable.
Okay.
Yes.
So, okay, and then In case you are just joining us, it's Health Matters reaching you on NTA Channel 12 Uyo. And we have in the studio today with me Dr. Odua Kusanga, President, Medical Women's Association of Nigeria, Akwa Ibom State Branch. And today we are discussing malaria. What are those myths and beliefs about malaria? You just feel you can walk into the chemist and tell the man you want to treat malaria. Whoever told you are having malaria? You have to run a test first. And we also have situations where people rely on herbs to treat malaria. How effective is this?
Thank you.
Would you encourage this kind of?
Yes, I will answer that question like somebody who is in the system.
Yeah.
We have situations where a lot of all these illnesses, they are surrounded by myths and beliefs.
True.
Somebody will say, don't add so much oil in the food because malaria, the oil will contribute to malaria. Another person will say, do not give children egg so that they don't have malaria. Another person will say, I don't like yellow clothes because when I wear yellow clothing, I have malaria. But I will try and stop all those beliefs. I will try and tell you to disabuse your minds from all those beliefs that malaria is gotten from bites of mosquitoes. And research has told us that these mosquitoes are the female Anopheles mosquitoes that produce this Plasmodium falciparum, which is more common. There are other Plasmodium species. We have Vivax, we have Ovel, we have Malariae. Those things still cause, those are still Plasmodium. But the one that is really, really causing malaria in our environment is Malaria falciparum. So those beliefs, please do not believe that by the time when you go under the sun, which is not even very encouraged, that you have malaria. Those myths should be disabused from your minds. As you are hearing me today, you'll be able to tell another person. Then concerning herbs, concerning leaves, concerning drinks, I am a medical doctor and I will not encourage you to take those. I know people go as far as dogonyaro, people go as far as pawpaw, mango, barks, guava leaves. But we must know that all these are drugs are got from stems, they are got from leaves and barks of plants. That we give 100% credence. But we do not know the dose. That's where our problem is. The dosage of these drinks, of these herbs, we do not know how many teaspoons. That is why I encourage orthodox medicine, because those have been synthesized in the laboratory. And I want to encourage you that as you are taking these tablets, still know that it's a form of plants. It's still a form of herbs, plants, leaves, barks of trees, even roots, as much as roots. Yeah. So just know that they are gotten from plants, but your own has no dose. So that is where we have the problem with the therapeutic effect of those drugs because of lack of dosage.
Okay, so your last word to these people, your last word to our viewer out there.
Thank
what
you.
Would you advise them on managing malaria?
Thank you very much. I will advise us, the last word, that we should be able to keep our environments very neat and tidy by cutting our grass, by making sure that we do not have pools of water, because the pupa stage, the hatch and the larva, they hatch in pools of water. They hang in bushes around us. And we should be able to put mosquito nets in our door, our window. We close our doors, and we should be able to make sure that, especially for pregnant women and children, we sleep in insecticide-treated nets. Mosquito nets are very important. Adults should sleep in mosquito nets. There's another myth that I forgot. They used to say that mosquito nets are hot. Those things have holes that air is coming in. So those tiny holes, please make sure that they are not torn. If they are torn, we could stitch. We could get another one. We should not believe that because another person stayed there and sweated, and there are people who sweat even in the office, even in an air-conditioned environment. So please sleep inside insecticide-treated nets, and protective covering is very important. Those are preventable causes. Thank you very much.
So you've heard it all. Malaria can be prevented. Don't go away. We'll be right back. Stay on now with Utiba Chibon for the vernacular version of this program, Health Matters.
ukangin mi komo ami nkere utebe achibo defo soko kopda ngayene kanyin ma pasi umo asokotang abanga ye ataro kefang abebo mbakara etange banga malaria do udongo utunyin etang mention su sondang udongo mieke medina mawo udongo utunyin do ke edieke ake medina mawo edieke umana bon adomowo ndion ngo musong aba tang beda ekpan udongo mi ado ni mention su mpona antini na mke pani ko nyongi diongo ibanga udongo utunyin mi adoke abo kere re kama wo mwana wo ni toyin eke medini udongo mi kpanante fukbe baba nko udongo mi si o weto se a edieke fomu na ma si bere po yange nam me mbia ibon baka eno me wo musong da bekere boke abongo mi idomo anante fukere boke nkan konfo anayi sana usong mo ngedam eko to gota ina aba akpelo fonfo agbe baba akpelo fonfo kele boke itiendo sana wido ngombio awido kommo nkan konfo ngo udo kommo yang mo twagada mo ngopeda kat boke menam ya uto mo do kam afere from komero me pede ama biro ke mo ngidara ke nkan konfo afre fon bo apana kwan ketang banga udongo ase soke awana yimbat edieke nkan ko sanake atawa wa udongo ikbisi na mawo amiena afre wo enyutum edikan bokena nkan ko mo asana nko fonko ana fo ka fo ibo ndion inye ro boke eruboge de mena ekama akene da ngampoba ana manyedo fo kwenye etong fana gidem ana afege bene abe bomba ka yanko kusidem afori o me fomeni udongo tonyi mensinsio idiongo dangata ibomba ka do sokotam anam abanga akwena ma ya mewedi o ke udongo soko siso bikobo mikidem ado udongo tonyi bosomu biagi wod iworo yo biak fin bosomu fiwidem ko umam fin iwo ngokeke amako fiwidem ke frefre ne ko fiwidem ado ke menu udongo tonyen uba ne meke mi fio ko bu fio mi nyom ngido udongo tonyen anyenam ido ke so ko ko na ngo ba ke ne foda kaka iti ko chemist oda kaka pharmacy age bi no ibo ko minangena ana kre bo ke fo me aside mfo aka test ke side mfo ba to ro monde di o sunam fin ke ado ma ke ko ni mo ya di o sido mfo na me udongo tonyen edi we ibok don dinu no fino fo ti yo nini bo na ante fo dat na to do udongo do akwini ma kom na uje gide ndio ni wuru bia uba ni ko ngodiana uba ni usongi to musa min sunsun bontoro oke na misida ka unam fin ngo fo yo ngodi adi yo ngokipon apa ku fonfo ayena mo kare se sanga ndio eno ngo mpo ekodo mosquito treated net adogo ekoru fo robon uba ni si ise medudu ku foro no yige na mo foro yige minini so ki mane ro kidara nete mi sene yine ka anwam edika ndo kidang nete min sene ko wufyo nkana fodika nge biara ko so mo ko ku fogibo akene na ngayemi ipanu do ngomi edike nyini gbe na ku foro bo ida o foro bo ngomi di tonyin ki na udo ngomi idi sopi mo ayo mo fone di ko bitem na mitem sia afono foli ba ken song edem nkana le don den fo ka fo bo akebia da ko akene na ni ri ko pitem udongo mi nko fo gbe ni udongo mi usobo ri wo ngo keke na fo adaka ka ke no edem fo so ana fo kat mi mbia e bomba kara sa mo ni ngin sunsun to ifyo e ba nga men sunsu udongo yimusong dange kemeri yo udongo mi ku ba ibon ku se mi bon amako da mo ba kidem kat boke me ka fongo akena mneke mpose pe na antene mba atoro iso gidiaro go yukara isio mudongo unyo ukangen so songo taiti senyine giso ki kamedi mfanelo lo tuti ni mfen ye mani sobo iben ikomfen iritang inombufo ye mensensio usongdang ibida ibaken song idem so songo taiti mintomkere utbe achibo